Hi everyone, I'm Scott Hozebin, CEO of DirectCareAI. Today I want to break down one of the biggest structural shifts in Medicare diabetes care that we've ever seen. CMS is moving continuous glucose monitors and insulin pumps into national competitive bidding under a new remote item delivery model. This video will give you a clear overview, and over the next several weeks, I'll release deeper dives on each part of this transition because it's complicated. This is not a small update. This is a complete restructuring of the entire CGM supply for Medicare beneficiaries. It's going to affect your practice, your staff, your DME partners, and every patient who depends on these devices. Let's walk through exactly what is happening, what it means, and how DirectCare will help support patients and providers during this transition. Let's start with when is all of this happening? CMS has released the full schedule for the next round of competitive bidding. So in December 2025, which is essentially now, CMS begins the pre-bidding supplier awareness program. This is moving quicker than I think anyone would have thought. In late spring or early summer of 2026, CMS will announce the registration dates. They will also announce the lead items and the number of contracts for each product category. Bidder education will begin at this time. And then later in the summer or early fall of 2026, bidder registration opens. This is when suppliers obtain a user ID and passwords, the bid window opens, and in late summer or early fall of 2027, CMS will award the contracts and announce the single payment amounts. And then beneficiary education begins here. And no later than January 1st, 2028, the new contracts and payment amounts will go into effect. A 6-month patient transition period will begin at the same time. So all of the shift of patients will be expected to take place in this window. These dates matter because they determine when documentation, supplier changes, and patient communication will hit your workflow. Now let's talk about the biggest change. CGMs are moving to a monthly rental model. For years, Medicare's treated CGMs as a one-time receiver purchase that's meant to last for 5 years, plus a monthly supply allowance. That model's gone. CMS is moving CGMs to a continuous monthly rental with one monthly payment, and all supplies are included in that: sensors, transmitters, receivers, and any accessories. The contracted suppliers will own the equipment, and they may bill for up to 3 months of rental in advance. Here's the key number. CMS has capped the maximum allowable bid at $272.69 per month. Because competitive bidding pushes prices down, the real-world winning bids will likely land between, say, $220 to $240 per month. These monthly payment amounts will be updated in year 2 and year 3 using inflation adjustments, but they cannot exceed the unadjusted fee schedule amount or 110% of the adjusted schedule amount. And CMS has been really clear. Contract suppliers must furnish the brand of CGMs ordered by the physician, especially during the transition period. This is an important point. Now let's talk about the second major change. The supplier market is about to shrink dramatically. Right now, hundreds and hundreds of DMEs provide CGMs to Medicare patients. Under this new system, the number could become 10 national suppliers, maybe 15, but not 100, not 50, 10, maybe 15. Here's how CMS gets to that number. They review 2025 CGM claims, then they identify every supplier that delivers at least 3% of the total national allowed services. Historically, that's only been about 8 suppliers. They multiply that number by 125%, and that becomes your 8 to 10. The final number will be announced in late spring or early summer of 2026. This transition to likely suppliers is big. So who are the most likely 10 suppliers? We know some of them. So based on multi-year Medicare data and national market consolidation, the top candidates include groups like Cardinal Health, which is the elephant in the room now after they acquired Edge Park, Advanced Diabetes Supply, US Med, and account for probably close to 20% of CGMs that are distributed. I think it's safe to say they'll be in the mix. Then you have other of the largest groups like Solera Medical, Byram Healthcare, Better Living Now, CCS Medical, Total Diabetes Supply. There's a company called Rotech that's consolidated a large number of smaller DMEs. They likely come up with a unified brand. You have other ones like Home Care Delivered. From there, some larger middle market players with strong growth like a Quest Health Solutions might make it into the mix. These companies already handle the majority of CGM distribution and have the infrastructure required to support Medicare beneficiaries nationwide. Transition to what's that 3% threshold, right? Next, let's talk about the threshold for what's a qualifying to bid. This is the question every supplier is asking. How many Medicare CGM patients do we need to serve just to participate? Well, here's some of the math. Medicare supports around 2 million CGM users. Together, they generate 20 to 25 million supply units or CGMs per year. 3% of that volume is 600,000 to 750,000 of CGMs, or say 50 to 70,000 Medicare patients. If a supplier is not serving at least that many Medicare patients right now, they're not going to meet the minimum threshold, and then they won't be allowed or qualified to bid. This excludes about 95% of all existing DMEs. So let's clarify, what is this smaller supplier requirement? CMS requires that at least 30% of the awarded suppliers be classified as small suppliers. But small supplier doesn't necessarily mean a small local business that you might see in your town. CMS defines a small supplier as a company with $3.5 million or less in total gross receipts. So it's relatively small compared to the bigger players. But these companies must still meet the same accreditation, bonding, financial, logistics, and compliance standards that all the largest suppliers have to. Because of this, only a very small number of true small suppliers will be able to participate. It'll be interesting to see how they open up this group and who makes it in as time goes. Most of the winners will still be mid-sized or large national suppliers. So let's talk about the 6-month transition period that's starting in 2028. During this window, patients will shift from non-contract suppliers to contract suppliers. If the old supplier does not transfer the documentation, the new supplier has 6 months to obtain new orders from the physician. This will create a sharp increase in documentation workload for practices. It's going to be a lot on the healthcare system. DirectCareAI is designed to absorb some of that burden and help the practices, the patients, and the suppliers. Let's address the biggest risk in this entire system, the capacity. When CMS consolidates hundreds of suppliers into, say, 10, those 10 companies become responsible for every Medicare CGM delivery in the United States. Every sensor shipment, every refill, every replacement, every transmitter, every new order, every renewal, every documentation check, every service call that every customer has, every compliance requirement for every beneficiary nationwide that wants a continuous glucose monitor. And all of this happens under reduced reimbursement and increased requirements to the DME. So CMS has even added a termination clause allowing them to cancel contracts if any kind of access issues arise. So that's a clear sign they expect strain on the system. And we know it's going to happen. It's happened in the past when we've gone through similar situations. So this creates real operational risk and real danger of patients falling through the cracks. This is where DirectCareAI can help. When the supply chain changes, everyone needs support: patients, providers, and suppliers. DirectCareAI was built specifically for moments exactly like this. One, we coordinate our patients with a physician encounter that's convenient for them on their schedule from home. And then we help coordinate the documentation. We schedule a visit, we capture the diagnosis, document insulin utilization, therapy history, make sure all of the CMS requirements are met so that it's a clean, complete, and audit-ready file with nothing missing and nothing rejected and no delays. 2, we prepare and route DME-ready documentation so that we can identify quickly who the correct supplier is and get that documentation packet when we send it directly to the contracted DME. So your team, whether it's a physician, existing DME, or just an individual patient, so say patients don't get stuck. Your staff does not have to drown in unnecessary calls. And that's where we can really come in and help guide everyone. We can guide patients through supplier transitions, explain the change, walk them through the onboarding, and help ensure that they never miss a sensor shipment. And we can do this at scale. So this is especially important for seniors who are most vulnerable to supply interruptions. We provide ongoing coaching and monitoring so that their CGM, just getting it isn't the finish line. We monitor the data, we identify the patterns, we can escalate issues to physicians, and we reinforce adherence during this supply chain instability so we can keep good, reliable utilization of their continuous glucose monitor. We don't just help patients get the device, we help them use it safely and consistently. So CGMs are entering national competitive bidding, and reimbursement is dropping, the supplier market is consolidating, volume thresholds are massive. We're talking millions of people. This documentation demand is going to grow and it's going to surge, and the entire Medicare CGM ecosystem is about to shift. With changes like this comes disruption, but DirectCareAI is built specifically to keep care consistent, compliant, and coordinated through this transition. So if you're a provider, medical group, or one of the future contracted DMEs, and you want to ensure that your patients never experience a gap in CGM supplies, we're here to help. You know, DirectCareAI was founded to make CGM access simpler and ongoing CGM use a better experience. So our mission remains clear. Let's work together so no patients fall through the cracks.